Hi, Dr. Tabitha. I'm so glad to have you here today.
Oh, so excited for this conversation.
I know. Well, we were pre-talking before we got online, and there's so many things came up that I just can't wait to share with everyone. So you are a functional gynecologist. So actually, could you just start a little bit about telling us how you got into the space, what sort of brought you to this area and how you practice functional gynecology?
Yeah. So my path was not very traditional. I was a teenage mom and high school dropout that really opened up my purpose in life and showed me that I needed to help women have a voice and a choice in their care. It led me down this long path of going to medical school. And I did all of the work. I went through undergrad residency, became an attending physician. And fast forward like 10 years, I found myself burnt out, barely surviving. I had little kids I was trying to raise, and I was chief of staff, and I was delivering babies all night, doing surgeries and seeing patients all day, living on donuts and coffee and whatever I could grab at the nurse's station. And I was really a hot mess. But here I was, like the go-to person in my town for women's health, and everybody would trust me to, help them feel better and solve their problems, and I was a surgeon. I love doing surgery. And so at first glance, it looked like I had it all together, right? I'd go to the grocery store and I'd see the babies that I delivered, and that was super rewarding and wonderful. But underneath it all, I wasn't really helping women feel better and live an amazing life. I was helping them manage their symptoms or just get through their day the same that I was. And I was going through a lot at the time. I eventually had a back issue where I couldn't even walk away from the C-section table anymore. I had a few days where I tried to walk away, and I had to just stand there and hang my body to let my back open up before I could even walk away from the table. And you can imagine, like during vaginal deliveries, that was not safe. I needed to be able to move quickly and respond to things, especially in an emergent situation. And so I went down this path of trying to heal myself. And I was also struggling with heavy periods, just like all my patients, right?
Yes.
So I found the world of functional medicine. And what I learned was it was a huge slap in the face. It was like, what have I been doing for 10 years? Holy crap. All I'm doing is covering up symptoms and root causes by just managing pain, managing bleeding. I'm not really fixing or healing anybody. And that led me on a really long journey. And of course, once you know better, you have to do better, right? So I started studying functional medicine, and I had I've learned so much, and I went back and I tried to do my job the same, and I couldn't. I could no longer see patients for 15-minute appointments. I wanted to ask them about their diet and their stress levels and if they were sleeping and how their marriage was. And it just time didn't allow. And so I really realized that in order to help women, I had to give up my current practice of medicine. And that meant leaving the hospital system. So that was the scariest, hardest thing I've ever done. I gave up a salary job. I gave up my 401k. I gave up my chief of staff and chief of OB department and all these positions. But it's been the most rewarding thing I've ever done, because I used to do surgery every week, like 4 to 6 hysterectomies and ablations and all of these things, thinking I was healing women when I really wasn't. I was just giving them new problems. And now I don't do any surgery, and my women actually get better. They actually heal. They get off medications. They feel amazing. They lose weight. They have energy, where none of that was possible when all I had was birth control pills and surgeries as tools in my toolbox, right?
Absolutely. And when you get to see those amazing transformations from making sometimes even simple changes in people's lives, it really makes a huge difference and so rewarding.
Yeah, exactly. And so now we actually find out why you're having symptoms, because I think a lot of physicians and patients don't realize that symptoms are just messages from your body. It's your body yelling at you saying, hey, time out, see what's going on because we're unhappy. Something's wrong here. We're trained to just cover it up or get rid of it. But in reality, we're supposed to be listening to it. And for it to truly resolve is to figure out what it's saying to you and fix that problem, and then the symptom will go away. So, how you approach gynecological issues depends on whether you're a conventional or a functional gynecologist. So I actually had never heard the term functional gynecologist. I thought I made it up because that's what I was doing. I was no longer using birth control pills and IUDs and surgery to handle heavy periods, painful periods, mood swings, all of the complaints that women have. I was now evaluating the gut and looking for food sensitivities and hormone disruptors in their life and helping them manage stress and sleep better. And so just the idea of finding the root cause of why you're having your GYN issues like fibroids, endometriosis, infertility, all of it, that's functional gynecology, getting to the root cause and actually healing those hormone imbalances. So,
yes, well, that's wonderful. And you had said something to me earlier. That's before we were live. So I really want everyone to hear this too, because you were saying about how we assume that our gynecologist has been trained in all of these hormones. So you assume that they're educated in hormone balance and how they're actually really trained more for surgeries than hormone balance. And I think that's eye-opening for a lot of people because we go to our gynecologist, we put trust there and expect that they know how to do this and are advocating for that. And that's not always the case.
Right. We look to them as women's hormone experts because they only take care of women, right? And they deal with the intricate details of women, the pelvis, the fertility, the pregnancies, the menopause. But I promise you, conventional gynecologists were surgeons. I spent 4 years in a surgical residency, learning how to do a hysterectomy 4 different ways, how to do C-sections in 90 seconds, how to, do episiotomies and repairs and all kinds of endless office procedures. I did not study hormones in the endocrine system to any special degree that your family practice doctor did. So I came out of residency with some basic understanding of how the menstrual cycle works. We all get that as doctors, like your estrogen and progesterone go up, it comes down, you have a period. We were not taught all of the hormone imbalances that exist in this day and age because for a few reasons. When we go to medical school, what we learn is already antiquated. The textbooks were written decades ago. They get updated, yes. But honestly, what I learned in medical school in the year 2001 was pretty much the same as what somebody who went to medical school in 1970 or 1980 learned. It's the basics. And a lot of it is inaccurate at this point. We've come to understand that what we thought we knew was incorrect. But that information doesn't always get translated into our educational system. And then you go and you enter a residency where you are trained by current attending physicians. So they're practicing the way they came out of med school and residency 20, 30 years ago and have been practicing the same ever since. And so you're taught their bad habits and their bad thought processes and everything else. And you bring that forward. That's very common. And then the third thing is big pharma runs the medical system. Honestly, I had lunch with drug reps 2 to 3 times a week from my first year of medical school until I left conventional medicine, all through residency as an attending. They come to your offices, they come to your apprenticeship places where you're a medical student, they come to the ORs, they come to wherever doctors are, and they tell them about the latest and greatest drug. You spend 10 minutes hearing about how this treats whatever condition, and then you go out and you start using it. You don't have time to really study or investigate things for yourself, because honestly, I was trying to survive just like my patients. And so doctors have to rely on the drug companies to present the research to you. And unfortunately, it is very biased, because who's paying for those research studies? The drug companies who are going to make the money. And so we are very much in a broken system that only pushes forward drugs that are going to make money in a new market. They're not necessarily the best thing for the patient. And the same thing goes with surgical devices. I must have tried 50 different devices during residency, different meshes to lift up the pelvis, different ablation systems to burn the lining of the uterus. It's a one big experiment. I'm just going to be super honest with you. Medicine is a big experiment. And unfortunately, the patient's concerns are not always in the forefront. So what I want women to understand is gynecologists are surgeons. First and foremost, we're not hormone experts. I had to go through functional training, anti-aging, hormone training, in addition to my 4 years of surgical residency to really grasp this. The bigger piece is these hormone imbalances that are so common nowadays really didn't exist for our grandmas and our great-grandmas and our great-great-grandmas. And people say, why? Well, there's a few different reasons. The biggest one is the environmental toxic burden. There are thousands of chemicals that now exist that didn't exist in the 1950s or before that. They were made in a lab by a researcher, a scientist. And if you talk to your grandma, she didn't know what plastic was. She didn't grow up with plastic. Now everything is plastic. And so we have to realize what these thousands of toxic chemicals have done to our physiology. And they have created things like estrogen dominance, which was never an issue before. When I was a medical student, it was exciting to see an endometriosis case because it was so uncommon. We'd all fight to get in the OR to see it. Now everybody has endometriosis because we have all these endocrine hormone disruptors in the plastics, in our food, in our water, in our cosmetics that did not exist before. And they accumulate over time. And so that is a big reason we're seeing these hormone imbalances. The other big reason is stress. Women are now having it all, doing it all, being it all. We were not like this 30, 40 years ago. We were just coming into the workforce on a regular basis and trying to juggle full-time careers and families and looking good and doing all the things. Now, that's every woman. Every woman does that. And chronic stress, this, all that cortisol production to handle all that stress robs your progesterone and causes an estrogen dominance picture. And it causes inflammation. It causes your cells to be broken down and not recycled efficiently. And so you get all of these dysfunctional patterns. It destroys the good bacteria in your gut. It causes leaky gut. I could go on and on. Another huge reason, alcohol. We never drank like we did before, especially the last 2 years. You've probably seen this with all of your clients. We are now drinking because we're bored, we're stuck at home, or we're stressed out and we deserve it, or it's a way to unwind, or we're trying to be social with our girlfriends and it's just the thing to do. And women's bodies were not created to drink alcohol every day. So every time you drink alcohol, your liver has to metabolize that instead of metabolizing estrogen were the plastics coming in or the other toxins? Because the liver's always going to choose something from the outside world before the inside world. So your estrogen levels can get all kinds of backed up, and you can get major estrogen dominance just from drinking alcohol every day. And we don't talk about that. That's like the number one risk factor for breast cancer. We want to say it's estrogen, but it's not. It's because we're not metabolizing our estrogen because we're too busy drinking and metabolizing alcohol. So I would say those are the three biggest drivers. And then the fourth, our diet. It destroys our gut, and our gut completely affects how we create and metabolize and reabsorb our hormones. And so as long as we are eating a garbage diet, we can never get into hormone balance. So I think that's really eye-opening. It was eye-opening for me as a physician. I'll tell you, like, I just never stopped and thought about any of this.
Well, we're not trained in the conventional side. It's like push, I think there's so many good things you said there. And really to even go back to what you were saying before, we'll get into some of these things, but like how you were saying, we're just educated by the drug companies. So it's like they want you on the medication because they're not going to make money unless they want you just enough that you can stay there. So, and then we're not really educated on any of the lifestyle factors that in that space either. So that is great. And I think so many good points about everything that's come up in our world today. And a lot of people don't even associate that the hormone balance, that there is a phase of elimination and detoxification of your hormones in the gut, and that there's such a strong connection there.
Yeah, exactly. I think as long as women are stuck in the conventional model of my doctor's going to fix me, they're going to have the answer, they're going to have the right pill to make me all better, we're not going to make any progress, and you're not going to feel amazing and get your life back. Like I tell women, you have to take responsibility. You have to be the CEO of your own health. You have to be in charge. You have to use your voice. You have to ask why am I being put on this medicine? How long am I going to be put on this medicine? Why is this helpful? And when you ask simple things like that and the doctor can't give you a good answer, or they give you a scary answer, like then you better go searching somewhere else. One thing I hear all the time is women going into menopause. The first line treatment is now an antidepressant, which it's killing me. It's like killing me that is the standard of care. Wow. We have stopped offering hormone therapy and now we offer antidepressants. So if I'm going through menopause, I've guaranteed I've gained at least 20 pounds from that hormone shift. And I'm feeling depressed because I no longer have estrogen and progesterone. So I come to you and you give me an antidepressant. I'm going to gain at least 10 or 15 more pounds. I was going to say you're going to gain more weight. I am not going to feel any less depressed. Mm-hmm. And now I have absolutely no libido to the point where I don't even want to be married anymore. And so what I see time and time again is women divorcing their husbands, or being absolutely miserable, losing their jobs, or struggling really hard in their careers because their brain no longer functions. They're no longer motivated to do their job, or they're too depressed to care. And these antidepressants are pushing that problem even further. So we're doing women a huge disservice. It breaks my heart because that is the standard of care, according to American College of OBGYNs and the North American Menopause Society. And who pushes that? The drug companies, unfortunately. Yes. So that is really difficult to hear because you're totally like absolutely not even really trying to investigate the root cause at all. You're just compounding the problem. Another thing. Oh, yeah, you go ahead. Oh, I was just going to say, and sleep. Like as soon as women start to go into menopause, they can no longer sleep. And really, it's because your progesterone has tanked and your estrogen has tanked, but they're given sleeping pills. They're given Ambien and Lunesta and these that are very addictive. They don't actually cause restorative sleep. They cause a lot of dysfunctional sleep patterns. So women don't get, the rest they need. They don't have the energy during the day, but then they can't get off the medications either, right?
Yeah, because they're addictive. Yes.
Yeah.
Another thing I see all the time is people just being put on birth control. So, that's the answer. Actually, and I even see it where people are going in for just their regular appointment and their doctors are saying, you should just go on birth control. Like, it's almost like this, let's just put everyone on the pill for a lot of times, no reason at all. So, there's this push for the birth control, which is really disrupting your hormones in so many ways and nutrient imbalances. So can we dive in a little bit into that?
Yeah, I remember I had one patient, she was 14 years old, and she was coming in because her pediatrician really wanted her to go on birth control pills. She was having a little bit of a heavy period and some acne. And her mom questioned me. Her mom was like, why should I put my daughter, who's not sexually active, on this medication that's for birth control? Why are you using this for these other reasons? And at first, I didn't think about it at first. And I was like, because it works for everything. It helps with everything. And she's like, does it? Does it really? Is she going to stop having acne and have better periods? And then I started to think about all of the patients that I see all of the time that I would give out birth control pills, and they would call the triage nurse 3-4 weeks later with a new symptom and a new complaint. And we would go down this crazy pattern of, well, let's try this pill. Let's try that pill. Because there's like over 50 different kinds, different varying levels and types of synthetic progestins and estrogens. And so you play this game. It's like a dog chasing his tail, where you're like, oh, well, you just don't have the right birth control pill for you yet. We haven't found it for you. That's all a bunch of crap. The problem is your body does not want those synthetic hormones. The other myth is we say it regulates your periods. It regulates your hormones. It does no such thing. That is an absolute flat out lie. It does not regulate your hormones. It shuts down your hormone production. So normally our brain talks to our ovaries constantly in a back and forth communication of hormones from the brain, FSH, LH, and brains from the ovaries, or hormones from the ovaries, estrogen, progesterone, testosterone, and those talk to each other. The birth control pill shuts down that communication. It shuts it down completely. And so if you take synthetic hormones, you don't make your own hormones. That's why you don't have a libido on the birth control pill, because there's no testosterone in the pill and you've stopped making your own testosterone. So what I want women to understand is when you sign up to take the pill for reasons not related to birth control, what you're doing is you're masking the symptom with a synthetic hormone, and you're signing up for possibly a lot of other problems or side effects related to the pill. And often they are slow, insidious of onset. Like it might take a couple of years. And so you don't really realize. It's like, oh, you're not attracted to the same kind of person anymore. There's huge research study that showed it changed the kind of man you're attracted to. So that's kind of a big deal, because people get married to people they wouldn't necessarily get married to on the pill. It causes leaky gut. It causes food sensitivities. It causes mineral and vitamin deficiencies, which lead to problems metabolizing your hormones that you're taking and all of these things. And the list goes on and on. It can create and turn on autoimmune processes in women who have those genes that are susceptible. And so I'm all for birth control. Like I tell people, I wouldn't have gotten into medical school and done all the stuff I did if I kept having babies. Like I needed birth control for that reason. But I wouldn't have used it as long as I did if I would have known what I was signing up for, because I do have autoimmune conditions and I am prone to leaky gut and everything else. And so I just want women to have informed consent. We act like they're signing up to take a sugar pill, and they're really signing up for something that affects the entire future of their life and every aspect of their life. It affects the quality of their ability to do their job and their relationships and their health. So we need to have that discussion. Like, this birth control pill actually changes things. So I want women to realize, like, if you're taking the pill for acne, figure out why you have acne. Mm-hmm. It's probably because you have a gut issue more than anything, or you have a hormone imbalance or a sugar dysregulation like insulin resistance. Those are reasons why you have acne. You don't have acne because you need synthetic hormones. So that's what I would encourage women to do. And what I see time and time again, like I saw this pattern evolving, was women would be put on birth control pills for heavy periods. It would work for a while, or they wouldn't tolerate it. Then they would try and get an IUD to help with it. They would either bleed through that, or the bleeding would never stop. And then they would try to have an endometrial ablation, which is a procedure where we burn the lining inside the uterus. And then they would usually bleed through that in a couple of years and end up needing a hysterectomy. And then they would get breast cancer. Like, that was the pattern I repeatedly saw when I stopped and thought back to my 15 plus years in practice. And what I realized was those heavy periods way, way back in the day, those painful periods, that endometriosis, those fibroids, those were all warning signs from your body saying, we have a hormone imbalance. Please address, please address, please address. But we didn't address it. We masked it. We covered it up. And so as long as your hormones are imbalanced and not being metabolized appropriately by your body, that is going to increase your risk of developing cancer. That's just how it works. But estrogen in and of itself does not cause cancer. Estrogen's not dangerous. I want to tell women, like, if estrogen caused breast cancer, the majority of breast cancer would be in women who are of reproductive age, under 40 years old. That's where we would see breast cancer, but we don't. We see it after menopause when your hormones decline. And it's an incremental increase every 10 years you're alive. So an 80-year-old has a much higher rate of breast cancer than a 40 or a 50 or a 60-year-old. But we like to scare women. So what we do is we lump women from 40 to 80. We lump their risk all in one. And we say, you have 1 in 8 risk of breast cancer. Not if you're 40. Mm-hmm. That is in your lifetime. If you live to be 85, you have a 1 in 8 chance. But in your 40s, you don't have a 1 in 8 chance. It's like 1 in 26. So we like to scare women. And so the trend has been to move away from hormone replacement and, use hormones at all. So I like to explain to women, like, gynecologists just are misinformed and they don't really understand how hormones work and how to use them safely. So it takes a lot of re-education and finding the right practitioner to help you through and guide you through that piece. But I will say, like, the reasons women get breast cancer are using birth control pills inappropriately to mask symptoms, not dealing with the hormone imbalances, drinking too much alcohol, living crazy, stressful lives, having high environmental toxic burden, and a horrible diet. If you focus on that stuff, you should be able to safely take bioidentical hormones after menopause. You should be able to decrease your risk of breast cancer, because that's what everybody's afraid of, right? Yeah. So it's just a totally different way of approaching it. And, if nothing else, I hope women just stop for a second and go, that makes sense. That makes sense to me. Why am I so scared of hormones? Yet I take a birth control pill for 30 years straight.
Yeah, you're right. And then you're afraid of HRT. That is true.
Seriously, yeah. Like, we hand out this birth control pill, and as soon as you hit the age of 50, the doctor freaks out on you and says, you can't take that, and you can't take any hormones. So you got to go
Yes.
off all of it. It's just, it's absurd, but nobody stops to go, does this make any sense? There's no common sense left.
No, you're right. It's like when we have them and they're functioning well, we're taking the birth control. And I think, we were talking earlier too about the study. So a study came out in 2002 and really changed the path of the way we think about using HRT and all that. So do you want to talk a little bit to that? Because that, I think, is a big part of why we have this.
Sure. Yeah. So the Women's Health Initiative was a huge study put out, designed to look at women and how their health was affected by hormone replacement therapy after menopause. And up until that study was created, we all believed hormone replacement was healthy and good for women, and it protected their cardiovascular system, their brains, their bones. And so when I went through medical school and stuff, like, it was standard. You just give the estrogen. That was really common. You took out their uterus and gave the estrogen, because the thought was progesterone was only needed to protect the uterus from unopposed estrogen. We didn't realize that progesterone receptors are throughout our whole body, but we're still being trained to this day. That's how gynecologists are trained. Just remove the uterus, give estrogen, and she's good. But this study, there's a lot of problems with it. 20 years later, the truth has finally come out. A few of the principal researchers on the situation have finally came out and said, we wanted to prove that hormones were bad from the get-go, so they were already biased. They wanted to stop estrogen replacement for women. It has to do more with political reasons. It has to do with keeping women out of the workforce. This is the truth. One of the researchers came out and admitted this in like 2018 or something. It was really sad. Yeah. So they set up this study to prove it. And what happened was they had two arms of the study, one who just took estrogen, who didn't have a uterus, and ones who took estrogen and a synthetic progestin. And the estrogen they used was conjugated equine estrogen from horse urine. So it's not chemically the same as what our body makes, estradiol. And the progestins are not the same progesterone as our body makes. So they're two synthetic hormones, and they were given to these women. Average age of the woman in the study was 63. So she was already 10 years or more out of menopause. Her body had been without hormones for 10 years, and they reintroduced these hormones. The majority of women were smokers, diabetic, and had heart disease already going in. Yeah. Mm-hmm. So this is not a healthy population to begin with. And they knew that going in, that they were not picking the appropriate population, because what they were quote saying they were studying was women going into menopause that was otherwise healthy. Well, that is not who they studied. No, yeah. So what did we learn from this? We learned that women who are more than 10 years into menopause, who have comorbidities like diabetes and heart disease, probably shouldn't be put back on hormones. It's not the safest. Those disease processes have set in. We shouldn't use the synthetic versions because it showed an increased risk of blood clot and stroke. And the arm that had the tiny increase in breast cancer that the media blew out of proportion was actually not the estrogen only arm. It was the estrogen and progestin arm. So there you have it. It's the synthetic progestin group that had an elevated risk of breast cancer. And that's what's in birth control pills. So yes, I promise that will not be studied. Yes. Mm-hmm. The entire country would be up in arms. Yes. Every side of the country, right? Like the feminists who don't want you to take away their birth control pills will be pissed. Yeah. Like everybody will be angry because I get it. Like we want that freedom. I want that freedom as a woman to control my fertility. Yeah. But I also want the truth. So I really want women to understand, like, there's a safe way to do hormone replacement and a not so safe way. The not so safe way is to get synthetic hormones and never check your labs, never have any follow-up or guidance by a conventional gynecology who hasn't been trained in this. The safer way is to test your levels, see where they're at, and try to go for an optimal range of replacement and use bioidentical therapy. So this also causes a lot of confusion because the misnomers. So synthetic, in the world of alternative, holistic, functional medicine, synthetic equals bad, right? Yeah. But technically, you know this as a pharmacist, synthetic just means it was made in a lab and not out of a body or something natural. So bioidenticals are often synthetic. That's what gets confusing for people. Bioidentical means it's chemically the same structure as your body made. It doesn't mean it came from a body, doesn't mean it came from a plant. It means that if you look at the molecular chemical structure, they are the same. That can be made synthetically in a lab. So, but we say bioidentical and then we say synthetic. So when I say synthetic, I'm usually referring to the fact that it's not chemically the same as what we make as women. So that is very confusing.
Yes.
Gynecologists are very confused about that. Yes. NAMS, ACOG, none of them can get it straight either. So essentially, you want estradiol, you want progesterone. Those are what your body is used to, and testosterone. Those are what your body has receptors for throughout the body, not just in the ovaries and the uterus. Like the biggest one example I like to use is the progestin, that's in the birth control pill, that's in the IUD. It will bind to the receptors in the uterus and send pretty much the same signal. It will say, stop growing that lining, slow things down, and it will keep the lining in check. So Provera, which is a progestin, will work on the uterus, same as progesterone, but it has the opposite effect at the receptors everywhere else in your body. So progestins cause weight gain and depression and anxiety, whereas progesterone, which is what we normally make, makes us feel good and calm and balanced and sleep well, and it controls the bleeding in our uterus. So you want to find a provider who understands these differences, because that's going to be the key to whether or not you feel amazing going on hormone replacement therapy, whether or not it's safe, and how to handle it long term. Because once women get on hormone replacement, they never want to go off. They feel so good. It slows the aging process. It keeps your arteries nice and flexible so that your blood pressure doesn't increase. It keeps your cholesterol in check. It keeps your brain functioning. It keeps your bones strong. So who wouldn't want that, Right. And I'll just tell you, Meg, like when I first came out into practice, I was younger, and I would always say, this is totally up to you. This is an individual decision, whether you want to go into menopause naturally or talk about hormone replacement. And I would veer them toward going into menopause naturally and just dealing with it, because that's where my comfort level was as a gynecologist. That's what I understood, is just go into menopause. We're not going to talk about it and deal with it. Just enjoy it. They were miserable, and I didn't understand the benefits of it. But now that I've gone through it myself, I know how horrible it feels for your estrogen to tank to the floor and never to be seen again. Like I couldn't even function. I couldn't get off the couch. My brain didn't function. I didn't want to be married anymore. Like that opened my eyes to really just how dramatic it is and how hormones help us be who we are as women. And people argue, well, if God wanted it that way, he, wouldn't have allowed us to go into menopause, blah, blah, blah. But just 120 years ago, the average lifespan was 49 for a woman. We did not live in a menopausal state that long.
So we also had babies at 16 or 15, right?
Exactly. Now we are living until 83. So you want me to live at least a third, maybe a half of my life in the menopausal state? I should have the right to decide whether I want hormone replacement or not, So my thoughts on that have shifted a lot over the
Well,
years.
and it's interesting because I actually I was talking with my mother the other day, like just recently about this, because I recommended that she do it whenever she was going through menopause. And then that was before all of this came out and all this controversy. Because when she was going through that, I was, giving her the safe ways to go through. I mean, over 20 years ago. And so and then all of this changed. And, it was just that we were having that conversation about how now more like everything you're saying, how there is the safe way to do it, how so much more data is coming out we should be supporting women, but it went from supporting to like, don't do anything. Like you can't do anything to now the real understanding of the right way to support rather than, just like, okay, you're right. Like not synthetic, but support in a bioidentical way.
Yes. And I inherited a practice of very mature women because I took over a gentleman who was retiring at the age of 74. And so I came into a practice of everybody who were on hormones. And, we were expected to take them all off from this study. Like, oh my God, everybody has to come off hormones. They're so dangerous. I had women threatening me, like, don't you dare take my hormones. And the ones that were taken off, especially by their primary doctors before they met me, I heard all of the horrible effects it had on their life. And so I felt blessed to really have that view from so many hundreds of patients of like, this impacts the quality of my daily life, my ability to function. And so I've seen things a lot differently than a lot of residents coming out into a brand new practice where they don't really have those experiences and those patients telling them how it impacts them. So I think it's really important. Find a provider who actually listens and gives a crap, right? Who knows what they're talking about, who says, yes, you need to test your levels. Yes, we know how to interpret them and adjust your hormones accordingly. Be wary of someone who does it only one way. That's another thing. Like pellets are all the rage. I do pellets, but I don't only do pellets because it's only for a certain type of woman in a certain situation. Pellets for everyone is not good. They can be dosed very high and cause a lot of new issues. And there's a trend now to make menopausal women back to reproductive levels. I don't believe you need levels to be cycling and having a period every month to get the benefits. I think that's a little extreme, but everyone's got their own choices. But what I would say is you don't want the cookie cutter approach. You don't want to go in and have somebody who only does something one way. Just same thing with like, I only do compounded creams, that tells me they don't really understand the intricacies of hormones. And women are always surprised that I use standard prescriptions a lot of the time for hormone replacement. But women need to realize that there are standard prescriptions that are bioidentical, which that's another myth out there is if it's not compounded, if it's not a pellet, then it must not be bioidentical. The estradiol patch is a standard prescription that you can get from any doctor. Insurance will partly cover. And it's bioidentical. It's what your body normally makes. Same with progesterone, micronized progesterone. It's a cheap old pill that you can get as a prescription. And so a lot of women are surprised by all of this. And so I would say, do your homework. Know that there are options. There's ways to feel amazing. You don't have to just do what your one doctor is comfortable with anymore in this day and age, right? Like everything's virtual. I see women all over the place. Like, so do you. Like your hometown is not your limitation anymore.
And it's wonderful. And it's just so wonderful that we're talking about it, that we're actually having conversations. I think before it was just like, oh, you had to keep that private, or people felt uncomfortable coming out and just, talking about it, like saying how we feel. We're all going to go through it. I mean, it's something every woman is going to have these changes in their life. So to do it in the most the best way you can is really impactful.
Yeah, I would say women don't even talk to their moms about it. I hear that all the time when I ask, like, how old was your mom? How was her situation? How did she go through it? Because oftentimes that's how you'll go through it. And that women don't know. They're like, well, I remember her being crazy for a little while, but we didn't really talk about it. So I don't know if she's on hormones. I don't know what she's doing. It's like, that's really sad. We need to talk to each other.
Because we're all, we can all be there for each other. And yes, I think the conversation needs to keep coming. So yes. Well, it's been so great to talk with you. You provided so much wonderful information. Can you tell our listeners how they can find you?
Yeah. So if you just go to drtabatha.com, it's DRTABATHA, 3 A's, no I's. You can get in contact with my team and schedule an appointment with us, or, just get our freebies, how to balance your hormones naturally. Like, that's always a good place to start. And just really realize that you are capable of feeling amazing, having the energy and the brain clarity and the body that you want. You just have to take that back into your own hands and be proactive about it. And don't look to the white coat for the solutions, because they just don't have it.
Yes. Well, I love that. And thank you so much for being with us today.
Thank you.